started here. So let's just start with a big thank you, Jeremy. We appreciate you taking the time to do this and to kick things off. What would you say to your fellow FQHC CEOs across this country who say we're in a period of uncertainty, or we don't have a budget for recruiter fees, or even we're worried that Medicaid cuts could put us out of business? And on top of that, why did Camino now decide to invest in search services during these uncertain times?
Yeah, it's a fair question. I think, for us, we're really taking stock of the fact that Camino's been around for over 42 years. We've weathered challenges in the past, and we've weathered changes in terms of our funding, threats to Medicaid and Medicare in particular. And for us, our mission and our need to preserve access doesn't change. And so it's really taking stock of the fact that seeing patients is not only the most important thing that we can do day in, day out from our mission standpoint, but it's also going to generate revenue. And while that paradigm might be shifting, in order to preserve access, we need to have the best providers that we can find on the market. And so we look at it as, frankly, a return on investment. We're really trying to compete with our local market, and we wanted to try to find providers who are a good fit for what we provide and our mission. So everything seems like a challenge in terms of cost right now, if you pay attention to the news cycle, but finding providers who are aligned with the mission and want to sign up for what we're doing is really important. So we see it as a worthwhile investment, despite what's going on at the federal level.
Excellent. Thank you.
Yeah.
And you've worked with our team on provider and administrative searches, specifically completed ones, medical director and COO. I know currently, CHRO and some other provider and APPs. Can you speak to the quality of candidates we've delivered and how they've impacted your team and your patient care?
Sure. Yeah, I think, we've worked with other recruitment firms historically at Camino. And I think the difference that we've noticed is the customization for that UHC brings in terms of what we're looking for. So as you could probably attest to, we've been pretty specific in terms of who we're looking for and what we need. And even going back to our last question, what's most important is providing services for people who are in need. And anytime that we are having to spend an inordinate amount of time sourcing and reviewing candidates, it's time and resources that we're taking away from doing the most important work. And so where we've really seen the value is that the quality of candidates has been significantly better out of the gate. And you guys really do a lot of the legwork in terms of not only sourcing them, but really giving us those folks who are a fit, organizationally and culturally for us. And we've ended up with two really quality people. You mentioned our COO and our medical director. And although we haven't, crossed the finish line with our CHRO just yet, we've received really quality folks. And I think much more aligned with what we need than if we had just gone out to the market and seen who applied.
Excellent. Thank you. And on top of that, let's talk a bit about process. What stood out to you about our search process compared to maybe others you've used, either internally or with other firms?
Yeah. So kind of riffing on how I answered the last question, I think it's the amount of time that UHC spends on the front end to really understand our needs as a client and not to fill in those gaps. So if there's areas where you guys aren't quite sure about our answers or what we're looking for, you do take it a step further and get a layer down to really understand what we're looking for. And it's evident when we get those folks who come back, because typically they check the majority of every box that we're looking for. And so, yeah, I would say the front end due diligence in terms of process is key. Measure twice, cut once. And I feel like UHC does a really good job of that.
Excellent.
Yeah.
And kind of on top of that, again, some leaders worry about using a recruiter might mean sacrificing culture or mission alignment. How has your experience been in terms of getting candidates who truly understand the FQHC model, underserved population, and your mission at Camino?
Yeah. Yeah. I think that's been critical. We are trying to remain competitive with the market. We know that being mission oriented isn't enough. But having said that, folks really do have to have a good idea of who we are and what we do because our work's hard. And I think that UHC really understands the work of FQHCs in a way that other recruiting firms do not. And it makes all the difference in the world because folks come in eyes wide open, um, in a much more robust way than if they are just replying to an ad on Indeed or LinkedIn that we could put out there for ourselves.
Absolutely. And, hiring mistakes are expensive. They can be. And so,
Yeah.
can you share any specific ways working with us has saved Camino time, money, or resources, either speeding
Oh
up
yeah.
the process or avoiding a bad hire?
Absolutely. We we actually have had some candidates who we have sourced who have not been in leadership roles in the last 12 to 18 months who did leave. And we've been talking about this as a leadership team, that switching cost or that sunk cost on the front end of the investment of time and resources that we put in. The second somebody leaves, it just becomes that much more costly. And so the ability to find those individuals on the front end has really been invaluable for us. And we do, even though we are, you know, spending money to partner with you all, it's money well spent because those individuals by and large are staying with us.
Great.
Yeah.
And when you look back, was there a moment in the hiring process where you felt, this is why we brought them in? Any particular interaction or insight that reinforced the value of working with your team, or even, impact that, you know, the COO or medical director have been able to make at Camino since they've started?
Yeah, for sure. Well, I'll speak to one that's a little more recent, and it's actually not been on the executive recruitment front. It's been as we've been working with UHC on sourcing clinical providers. And it was when our recruiter actually told us, hey, I know you guys have a just wage process and that you're benchmarking your providers against the publicly available data, but I can tell you you're under market. And I can go out and try to source people, but on some level, you're going to get what you pay for. And you really should consider increasing in some of these ranges. And at first, it was hard to hear, especially in the current environment.
Yeah.
But as we went out and kind of kicked the tires on that feedback, we actually agreed. And so we've been making some changes in those ranges and it opened up that bottleneck and we saw some really high caliber candidates come through. And that's something that would have taken us a lot longer to come to terms with if we hadn't been working directly with UHC on that. The second example I would say is I can think of one for our medical director and our COO, but I'll go with our COO. And I actually work directly with you, Joe, on this, and so that
Yep.
for me as a new CEO in the role, it was super important to have somebody who um, had his or her 10,000 hours and understood operations deeply. And there was a moment, probably maybe 6 months in, where she and I parachuted up and said, hey, let's really look back at what you've implemented in the first 6 months. And it was pretty phenomenal to see the improvement in some really binary things that might be boring to some folks, but are so important to, core operations. We reduced our wait times way beyond what our goal was in our strategic plan, simply because she had that deep experience and came in and attacked the problem head on. And it's made a tremendous impact on our patient satisfaction and our access. And at the end of the day, our revenue. Uh, Beyond that, though, it was really finding somebody who was truly mission aligned and wanted to come to us despite some personal challenges in terms of a commute and relocation and things like that. We were able to work through those things and overcome those hurdles because we found the right person. And I would point to those two examples to say, yeah, this is money well spent. This is a relationship that's important to us in working with you all.
Perfect. Thank you for sharing. And
Yeah.
finally, what would you tell another CEO who's maybe on the fence about investing in an external search partner like us, especially for hard to fill roles or key leadership positions?
Yeah. I would say that, the you will see the dividends of partnering sooner rather than later. Like most health centers, we all roll up our sleeves and are active in a lot of different things. And I've been able to focus on um, both the tyranny of the urgent and focus on day-to-day issues that come up, but also be more strategic, and even be more of an external presence for the health center in my role, because I have trust and confidence that you guys are really stepping into that recruitment role in a way that I trust. So yeah,
Great. Thanks again, Jeremy, for taking the time here. We really do
absolutely,
appreciate it. All right. Thank you.
absolutely. Thank you.